Welcome, everybody. Welcome to me and IBD Life show. My name is Elaine O'Rourke. I am your host here. This is where we discuss all sorts of things about having an ostomy, from the physical to the mental and emotional issues, and also for people with Crohn's and colitis. I do specific shows for that as well. This week, I am super excited because Nurse Anita is back on with me again. And our topic this week is how to deal with Parastomal hernias. Hernias are a big deal for people who have ostomies. So this is a topic that I think we will all learn a lot from. If you could like or follow me on Ostomy and IBDlife on Facebook, and then on Instagram, OstomyIBDlife, out on YouTube, Elaine O'Rourke Yoga Ostomy IBD. All of the episodes so far are up on my YouTube channel website, which is elaineo'rourke.com, and you can download your free guide for 3 ways to eliminate fears about your ostomy. Or if you have IBD, Crohn's, colitis, you can grab your 5 mistakes even well-informed people with IBD make. Nurse Anita, she is a wound ostomy nurse. So without further ado, hi.
Hi, Elaine. So thank you so much for having me here. Are you all ready for another radical ritual? Got my nursing cap on. Ostomy nurses all over. We all work really hard. We're just... we're out there to help relieve the suffering. I heard that quote today on a podcast. It's what we do. We want to relieve suffering for anybody that's struggling to adapt physically, emotionally, spiritually to having an ostomy.
Nurse Anita, you can call her. She does consultations.
AnitaNurse.com. You can reach me that way, find out more about me.
So I'm delighted that we're going to be talking about hernias, because it is something that you hear about, and people can be then afraid to do exercise, and it's one of those things you don't really know what causes a hernia, and there's different types of hernias and everything. But, I myself, I'm going to say I've never had a hernia. I've always been pretty fit and active, and I do believe that helps, and I've always been the right weight, and we'll be talking about all of that too. So I personally don't have experience with it, but I know that you do, Anita, with seeing
Yeah.
So we're going to be getting into what they look like, how they might feel, what you can do about it. But also, please know, we can't diagnose anything for you. We're just giving information. This is educational. So if you think that you have a hernia, then you will need to go and see your medical professionals. Nurse Anita is going to be sharing some different slides. So, you're going to see some visuals. The hernias, I think, can sometimes be way more difficult to manage than the ostomy. So you already have your ostomy, and then getting a hernia on top, you'll see with some of the pictures, they can get really, really large. And I don't know how people cope with that. That's pretty hard. Please put up comments. I will check in on them as well. Okay. So, Nina, let's bring up the slideshow.
Okay, here we go. Let's see if I can do this.
Yes,
I can.
I think we can get it going.
We'll try.
All right. I'm going to add that in. And okay. And then you just need to full screen that. Okay, great. So we got there.
Okay, everybody can hear me and see the slideshow with the puppy?
Yep, we got it.
Okay, so this presentation is about peristomal and parastomal hernias, or PSH is the new acronym. And a lot of people say, well, what's the difference between a peristomal and a parastomal hernia? Well, guess what? There is none. Okay, so they are one and the same. No difference. And you'll see it written both ways.
So Anita, just on that previous slide for people that were wondering, so that person, that was an actual picture of the hernia.
Yes, this is a woman who you can see a right-sided colostomy, and this big bulge around here is the hernia.
Yeah.
Okay, and we're going to see some front views, side views. And yes, so it's not that she's just a big lady. She's got a very large bulge here.
Yeah.
And we'll talk about how you can differentiate that yourself if you have concerns. Okay. So what is a hernia? Basically, a hernia, it's when your intestines sneak through the opening that created the stoma and start forming this little bubble of intestines between the muscle and the skin. So this is very common. It says found in 30 to 50% of patients with a stoma. I find it's more 50% and up. It usually occurs within the first year of having an ostomy. You can see on the picture on the left, the colon herniation. So this would be for a colostomy. And it can happen with ileostomies and urostomies as well. The large intestines has actually pooched right through the opening into that subcutaneous space and creates this bump. Okay, on the small bowel herniation, small intestines has creeped in there. And this can happen sometimes on one side, sometimes it happens on both sides. So,
oh, I didn't realize it could happen on both sides. Okay.
yeah. Yeah. Okay. So here's another picture. It's a little, fuzzy, but I wanted to show, this is the side view. If you look for the green line, that's your stoma coming out, right? So the purple is the muscle, the yellow subq, and then the skin. So you can see from this view, so I drew the circles. Those are the openings the doctor cuts to pull the intestines through. And as you see on the muscle, again, more intestines just wants to sneak through. So essentially a hernia is when you have the transfer of one organ into another. So think about that. So your intestines to the skin. I know we don't tend to think of the skin as an organ, but it is, and it's the largest organ of the body. So that's what makes that a hernia. And essentially the stoma itself is a surgically created hernia. Okay. So if you happen to get this extra bulge, that would be considered a parastomal hernia, as opposed to we don't call the regular stoma hernia, but essentially it's one organ going into another.
Right.
Surgically created. If you have this bowel loop sneaking into that orifice, into that cavity, then you would have a peristomal hernia. Okay. So here are some lovely pictures of different hernias I have seen in my experience of 20 years. The man on the left, I would say, is the biggest hernia I've ever seen. It's about the size of a volleyball. Oh. And he basically just carried this around. This is his stoma on the top. And you can see his stoma has just stretched out flat from that bulge. It's completely flattened out, and this is very common. And
can I ask you a question there, Anita?
Yeah, please.
So if that flattens out, that must be so, well, first of all, it must be just so hard then to even change your ostomy appliance.
Yes, it's very difficult, and they tend to leak a lot. But we also do have now new appliances from Coloplast called the Flip, their convex flip, which actually curves to the shape of a peristomal hernia. Wow. As opposed to convexity, which goes in when you have a dip. These curve around, and I'll show you that after.
Okay. And then can I ask another question here? So, I mean, how does a hernia get that big?
The intestines just keep sneaking on through. It just keeps bulging through.
So it's just more and more coming out. It's weakness in the wall, and it is all coming out.
Yes. And as you can see, this gentleman was not very fit to begin with. He was obese already. He did have diabetes. I believe he also was on steroids, which are some of the risk factors for developing a peristomal hernia that we'll go over.
Right.
Yes. So on the top right is a peristomal hernia with also has a prolapse. So that's kind of a wild and crazy photo. If it scares you, you should be. And hopefully this will never happen to you. This is a transverse ostomy. And he definitely had a huge bulge there as well. So double whammy for him.
So that is the stoma going out and around. So it nearly looks like two stomas. So that's
It's a loop ostomy. It's a loop, and both ends are prolapsing.
Oh wow!
Yeah.
Wow. And
so that's sort of my little curveball in there. So, but most stomas don't prolapse like that. Okay, that's different. But you can see the bulge.
Right. So then with this one, it looks like, so you got the stoma in front, and then the hernia is right behind it. It's not to the side of it. It's right behind.
It's all around it.
Wow.
If you can see, it's all encompassing that whole area. And that is really just below the sternum. It's very high up.
Oh my.
Yes. And the lady on the bottom, you can actually almost like see the intestines in this side view she has. And I'm sure if she pressed on them, she might be able to push it back in, which is another fascinating thing about peristomal hernias. They seem to come and go depending on your body position.
Oh, wow.
Yes. Mm-hmm. Yeah. So, and that's one of the reasons that if you have a hernia belt, an ostomy support belt, we suggest to apply it lying down, because the hernia will retract, basically.
Right. And that's why it can be so beneficial to wear the hernia belts.
Yes.
Yeah. Fantastic.
Okay. Yeah. And we will get into that too.
Yeah.
So the risk factors, as you can see, as I mentioned, a couple: being overweight, poor nutritional status, smokers, somebody with COPD, which is chronic obstructive pulmonary disease. And the reason, and these are lung issues, the reason why is because they make you cough. Okay, and whenever you cough, you put pressure on your abdomen. Okay, so think about cough now, and you will feel that pressure on your abdomen. And that essentially wants to push your intestines through the hole.
Yeah.
Okay, being elderly in itself, frail and elderly, doesn't help. If you've had previous abdominal surgeries, steroid use, if you've had wound infections, and also if you've had emergency surgery, can also be a risk factor depending on who did your surgery. Okay.
So when you say emergency surgery, do you mean emergency stoma surgery?
Yes. Particularly, most emergency surgeries are diverticulitis, or that's the majority of them. Most of the other surgeries are planned, and they have enough time to prep you for it.
All right. So this is, really for anyone that doesn't know, I work in health and wellness, doing yoga, doing a lot of mindfulness, a lot of different things, because it is so important. I feel I have a gift. I've been given a gift that I'm still alive, and I want to treat my body as best as I can. I'm not a saint about what I eat or anything like that, but I try to eat healthy, and I really try and keep my weight at the proper weight. And I know it can be a real struggle for people, but that's where we get help. We look at what are our blocks. Why are we gravitating towards eating, or why can't we?
Right.
get up and motivated to get exercising or moving. But it's so important. So, if you're watching this and you're going, oh my God, I don't even know where to start. Well, reach out, get in touch with me. I work with people one-on-one and I do group classes. So, get in touch. We'll just get you started. Sometimes you just need that cheerleading, on the side to hold you.
And again, most of these do occur within the first year, but some do occur in the second year. So if you already have a stoma and you're worried about getting a parastomal hernia, start taking some action, and we're going to go over some of that now.
And also another thing, just before you say that, so when you have surgery, any surgeries, you're told not to lift anything, not to do anything rigorous for the first 6 weeks. And that is one of the reasons, am I correct, Nurse Anita, is because you don't want to lift up something. Like, it can happen with the simplest of things, lifting up a carton, a gallon of milk, and that could be just too much. So that's why it's so important to listen to those instructions and don't lift.
Right.
And, I don't even push it out and say 2 months. And I know a lot of people are, especially if you are a more active person and you're just dying to get back into doing stuff, I just err on the side of caution all the time and say, give your body that time to heal, right? You've been through it. Give your body time to heal, and then you have the right time to get back into something, because you don't want to hurt yourself. You want to try and prevent a hernia as much as you can,
Yes. So again, manage your weight. You want to have a BMI less than 25. Your waistline less than 45 inches is one of the indicators. And there really is a paucity of research on parastomal hernias. I was thrilled to hear that University of Miami is starting to do some research on hernias. So that's great. But as you can see, this gentleman, he's a big guy, and I think you can see he's on oxygen. He has COPD. He's on steroids. He probably smoked, a lot when he was younger. All those things contribute to his developing that parastomal hernia. So some of the things you can do also to reduce your risk is, again, improve abdominal muscle strength. You got to remain physically active. Again, just walking, or just, you're not going to be doing crunches. And we do tell you to restrict the amount of weight, no lifting greater than 10 pounds for the first 6 weeks. Some people, depending on your risk factors, extend that longer. The other thing is, I read about a gal recently who developed a parastomal hernia, and she's like, I don't know why. The only thing I lifted was a case of water. Well,
that's heavy. That's heavy.
Yes. Yeah. Except a case of water. I'm just like, yeah. I know somebody else that developed one after rearranging the furniture. Okay. So no pushing either. Anything strenuous, anything that's going to use your abdominal muscles. And that's why we say too, when you cough, you need to splint yourself. You know what I mean by splinting? Holding yourself together. Put a pillow over your belly and, cough that way. This guy is a real stud. He's on TikTok, Ostomy Fitness 101. And, I bet he was in pretty darn good shape before he had an ostomy. But now he's really becoming quite the stud muffin in my book.
Here's a point that I would also like to make, since we're talking about this, is, and I see a lot, I'm always checking things out on social media and whatnot, and seeing what people are doing, because that's my business also. And often I see, people like this guy, he's totally fit and ripped, but the vast majority of people are not, and they're not, pushing weights and everything. So, sometimes you think when you get your ostomy, oh, okay, now's the time to really start doing all that strenuous stuff.
No.
Because you want to try and build up your core. Well, you got to start off slowly. Slowly.
Yes.
And next week I'm going to be doing a show on just the, how to build core strength, simple stuff. It's not, it's not the crunches. It's not, doing the weights. There's so many easy things to do.
Right.
Things that are really important to take into account as well. You can't compare yourself to anyone else, and that's why it's important to do what's right for your body and to work one-on-one with someone if you're not sure.
That's why ideally it'd be ideal if you have planned an ostomy surgery to get strong before your surgery.
Exactly.
So Convatec, Elaine has a great program, but I do want to let you know Convatec, the Me Plus program, does have an abdominal and core recovery series that you can look up online at Convatec Me Plus. And a lot of these are just simple, pelvic tilts, and similar to that, very, very simple exercises that you can do. And you can do these, as soon as you come home from the hospital, if you feel ready and able. Again, when you look at the Big Joe, Big Bulger guy, there was no way he was going to be doing any of this.
Yeah, exactly.
And unfortunately, a lot of people who develop hernias are not in great shape when they had the stoma created. So that, is definitely one of the contributing factors. And here is Elaine doing yoga. So I wanted to, absolutely, what she does is amazing. And, Elaine surfs every day. She does yoga every day. She's in great shape. And it's really important, again, to keep your core strong. So I encourage you to attend her class next week. I'm sure it'll be great.
And so on Thursdays, just as a side note, I'm doing a quick 15 minutes, just to get some breath moving and some very, very, very basic movements. Just yoga, just get up standing, just 15 minutes. So that's on Thursdays for the month of April. It's free. Just get on to follow me on, it's up on the Ostomy&IBDlife page on Facebook. And Instagram, I've been having issues with, but it might be up there. But if not, come to my Facebook page or my YouTube channel. 15 minutes for the rest of the month from 9 to 9:15 a.m. That's East Coast USA time. And then in May, I'm going to be having a little yoga series as well. So if you're interested, definitely send me a message and let me know, and we'll get you started.
Excellent. Good. Okay, so if you have a hernia, as I talked about earlier, there are ostomy appliances for curves. Coloplast is the only one that has come out with a product that adapts to your outward body profile, as they call it. And this is a wonderful product, and I highly recommend it if you do have a bulge and are having difficulty having good wear time on your ostomy. If you don't have any problems with wear time, don't change it. If it ain't broke, don't fix it. But if you are, consider contacting Coloplast and getting some samples of this. And that might be just the ticket for you. Another way I want to mention is how to check yourself if you think you have a hernia. And that is to standing up or lying down. If you can do a Valsalva Maneuver, which is when you kind of bear down, like as if you were going to, going to poop. You're going to bear down and you will see a bulge appear, sort of like doing a little crunch. If you're lying down and you lift your head up and you do a little crunch, is there a bulge? Does a bulge appear when you're doing that position? And that's usually indicative of a hernia.
Right.
Okay. So ostomy support belts. Wow. They have been so many different ostomy support belts nowadays. In a previous life, 10 years ago, there was only New Hope, But now every manufacturer is out there, and some are more supportive than others. Some are great for preventing hernias, and I'm not sure really that we know exactly if it really prevents it, but it supports your abdominal muscles. Okay, so if you have weak abdominal muscles, and granted, if you just had surgery, you're cut. Your whole rectus abdominis muscle is healing, and it takes a good 3 months at least for that to heal. And where they cut your muscles, all healing. So I think when I get back to the hospital situation, I'm going to encourage all my patients to have some sort of a support belt.
I think it's a great idea. You know, if you have been physically fit up to the time of having your ostomy, and if you're out and about and doing stuff, it's a good idea. You know, it's just going to help, and especially if you are starting to do exercise, get an ostomy support belt. You know, there's so many, as Nurse Anita is saying, there's so many different types of them. So of course, you know, you'll have to shop around to find something that is going to be right for you.
Right. And an ostomy support belt like that from New Hope is covered under your insurance. Okay, so insurance will reimburse for some of these support belts. Now, there's one like on eBay, good luck getting it covered. Okay, and Amazon, but if you get it from your DME supplier, chances are it will be covered. And they need to be replaced at least, I believe, every 6 months to a year. Okay, so they usually wash and drip dry, but the support does wear out over time. Right. So it is important to replace those. Don't think that's gonna, you know, support you forever.
Yeah, and I also believe, so if you're tuning in from England, I'm not even sure in Ireland, but I do believe that the NHS over in England covers ostomy belts as well, and I'm pretty sure that in Ireland they do. So no matter where you're tuning in, check in with your health insurance about that.
I know there's one out there on Amazon. It's called Corsinol, and I believe that comes from Sweden or Denmark. So yeah, this is a worldwide issue for sure.
Yes.
Yeah. Okay, so what do you need to know if you have a peristomal hernia? What are sort of, most of the times the doctor's going to say, you know, can't do much about it. But be aware of these issues. If you have decreased output, if you have pain, if you have abdominal cramping, excess distension around your stoma, more, if you're nauseous, these could be signs of a twisted colon. Okay, so sometimes in that little gap there, that intestines can get twisted, and you will end up with stomal necrosis, and you will need emergency surgery. Okay. If you develop a peristomal hernia, you need to remeasure your stoma as needed. Okay. You need to remeasure it periodically. You're getting bigger, so chances are your stoma is getting bigger and it's changing.
Right, and that might even, so if you're experiencing a lot more leaks going on, you may, you know, if you've been using a certain product up to now, and then you get a stoma or a hernia, then you might realize that, gosh, you need to try some different products.
Right. So stomal necrosis looks like your stoma is turning gray. It's getting dusky. It's trying to turn black, which is not a good sign. Okay. And the other thing, a lot of people with colostomies and peristomal hernias affects more colostomates than it does people with ileostomies and urostomies. And if they've been irrigating, they might not have as good a return. They might have trouble irrigating, and the guidelines do say that you should stop irrigation if you have a significant peristomal hernia. Okay, so those are the guidelines. I know a lot of people with hernias still do irrigate, but do it with caution and be aware. You may have issues.
Okay, good to know.
Yeah. So what about surgery? Everybody says, oh my God, I look horrible. It really affects your body image and your presentation, especially women. They want to have it revised. They feel like they have a third boob. You know, get rid of this. I can't stand it. And they will relocate the stoma to the other side. And trust me, this is major, major surgery. Okay, you're going under the knife again. You're going under anesthesia. They're cutting you open. And unfortunately, it might reoccur on the other side. Okay, this is something I've seen in my experience way too often, that these hernias recur. I would say at least 50% reoccur.
Oh, wow. That's really high.
Really.
Why is that just due to all of the reasons that we've talked about before, with being overweight, not having core strength to begin with?
Yes, it is. And having all those risk factors. Yes. And the other thing, I think genetically, like if your mother or father had a hernia, chances are you're prone to having hernias.
Oh,
I do think it passes along in the genes, because I have seen this in families. It's like, oh yeah, my mother had a hernia. And once you have a hernia, it just seems like you're prone to getting hernias. It's unfortunate. But the other thing is, I would make sure you want to talk to your surgeon about what techniques is he going to use to prevent you from getting another hernia. Frequently, surgeons will use a mesh that will go around the surgical opening to prevent those intestines from coming through. And again, I think it's hard for me to say. Again, there's really not that much research out there, but you saw they have to cut a hole in the rectus abdominis muscle and through the fat layers. You know, did they cut that too big? Did they cut it too small? It has to be just right. And I think this is a very challenging thing to do for the surgeons, is to make sure they get the right size. So talk to your surgeon, ask around, get second opinions, and ask around what techniques are they surgically going to do to prevent you from having another hernia.
right.
Yeah, I believe the breakwater is one of the most common techniques. It's just a surgical technique, but I have seen it, writings about that.
And then can I ask you, before we get the fabulous slide, how long or is it all just different for every person, but like how long would a hernia repair surgery take?
Probably, I'm not sure, but I think probably about 3 hours, 2 to 3 hours.
They would relocate the stoma at the same time?
Yes.
Yeah, that's major.
It's a major surgery. Yes. It's not to be taken lightly. Yeah. As is, when people have an ostomy takedown, is a major surgery. Anything on your gut is going to be a major surgery. And especially you have to look at the cause of why you had the surgery in the beginning. Did you have cancer? Well, if you had cancer, I'd be real hesitant to go in and start cutting you up again. If you had Crohn's disease, okay, but you need to take a look and really discuss these issues with your surgeon. Is your gut healthy enough to withstand another surgery? Because chances are you've been pretty sick.
Right. And then imagine scar tissue would also play.
Yes, absolutely. Scar tissue and adhesions, which adhesions are the scar tissues internally. Externally, you see your incision, and that's your scar. And some people keloid, if that's when it raises the skin, becomes raised and hard. And if you keloid on the outside, chances are you keloid on the inside.
Oh, yeah, right. That makes sense.
Yeah, it's different. It is different mechanism, but I have seen people with similar issues. in my experience, anecdotally. Okay, not research, but
Right.
okay. So that's it for me.
Oh, go back to the last slide, Anita. Come on.
For me.
You're not alone.
You're not alone. That's me, Anita Nurse. So.
All right. So that was amazing. I'm just going to take the slideshow.
Thank
here.
you. Okay.
Yeah.
Let's see if I can do that now.
I just did it for you.
Oh, wonderful. Oh,
yeah.
Thank you. Hi, I'm back.
I just learned a ton. That was absolutely so informative and amazing. So I hope that all of you out there watching and listening, that you have learned and have an idea of what to look out for, or maybe you discovered that you actually have one. So please put up any comments. I'm going to go in and check out our comments now and put in likes. And as I said, please share this. If you're on Facebook, just press the share button afterwards so that more people can see it. And same on YouTube, and let people know. And I'd love to get your comments. And as I said, you can also sign up on my mailing list. My email is, or my website is mentor.com, and I got free guides there and stuff for you. So Anita, I'm just going to go in and just read through and see if there's any questions. It's so funny. I was surfing earlier, and my eyes are just I can barely see out my eyes. They're all
I have a New Hope belt I want to show too.
Oh, okay, cool. We've got Orla. Hi, Orla, viewing in from Rochester. We got lots of people. Hi there to Peg. Hi, Diane. So yeah, Orla is saying that she has a permanent colostomy, peristomal hernia, and she's a cardiac RN. Thank you again. Thank you for your amazing work.
Heroes.
And then we have Shelly from Ohio with a temporary ileostomy, and I hope you're doing okay with that, Shelly. And if you're not, just reach out, get in touch with us. Let's see, I'm just seeing if we have any actual questions as well. And Peg has she says that she has a large peristomal hernia and waiting to get a rectal colon specialist at the end of June to see a rectal.
Colorectal surgeon. Yes.
Yeah. So I have the sun peeping through on my eyes here as well. There's incarcerated peristomal hernia. Okay, waiting to see. Okay, good. All right, let me continue along just to see if we have any specific questions. Hi, Harry. Oh, so Harry has a double hernia, as he has a urostomy and a colostomy. And he says he uses the Coloplast Flip as well. Yeah. And also that he had a belt made for a double ostomate by New Hope. So that's amazing, right? You got so just to, first of all, having two ostomies, but that's great to know that they will make
so I have a New Hope belt here. Ooh. Okay. This is a 3 panels wide, you can see, and they do come in 2 panel. They come in 4 wide. Again, when you get a New Hope belt, and this is custom fit to the size of your stoma, if this is probably a 2 1/4 inch appliance, they have to be custom made. Okay, so they come in all sizes depending, what appliance you're wearing, how big your waist is, and how big your hernia is. So we measure your waist all around, and then we measure the hernia up and down. Okay. From top of the hernia to the bottom of the hernia.
So, okay, so that's a great point. So if someone has a hernia, so then they should go and see someone like yourself, ostomy, so that they can get the right measurements for the hernia belt.
Right.
So
New Hope, you can call them and they will guide you as well. But it's really great if you have an ostomy nurse that you can reach out to, because again, you need to measure yourself laying down flat. Okay. I think you need to measure yourself standing up. And again, the length of the hernia from top to bottom, right? You know, over the bulge like this. And
Okay.
you'll see. So like my head is like, you know, 10 inches. But that's kind of what it's like, you know? So, but the hernia support belts are great. And they also even have something, a little flap for a prolapse, like my guy with the two, you know? So, and that would cover that and push that in as well.
Right. Oh, okay, good. And then, so Lenora is wondering, hi, Lenora, should you sleep with the belt on?
It's up to you. You can sleep with the belt on or off. It's totally, if it makes you feel comfortable, sleep with it on. If it doesn't, take it off. The other thing I say is to sleep on the other side of your stoma. So if your hernia is on the left, to sleep on the right.
Okay.
I'm not sure. And again, you're going to do what's comfortable for you.
Okay. And then Kathleen shares that when, I'll just bring this up here so it's easier to read. When I get something stuck in the hernia, I can barely walk. It's getting worse. It seems to happen when I ride a bike, but the pain is in my stomach too. Does that make sense?
Well, what do you think is getting stuck in your hernia? Is stools lodged in your hernia that it's not passing? If so, I would try to drink more water. Are you having hard stools that don't want to pass? Again, this looks like maybe time to see the doctor. If you're having issues, you know, without having stools, or, you know, sometimes that peristomal hernia, it can be painful because, again, think about that. Your whole gut is really distended. I would say it's comparable to being pregnant for a woman with, you know, with a big belly, because everything is pulling, and I'm sure it's got to hurt your back depending on how big it is.
Right, yeah, because you've been pulled.
Yeah, you know, so that's why, again, the support belt, in the old days, we would recommend this if for, you know, guys who worked in construction, you know, you got to wear a belt. But you know what? To me, I think pretty much everybody should wear something, unless, you know, again, it's a personal choice, but I think it can only help.
Right.
You know? And you got to try different ones too to find what's comfortable. So this New Hope one, you know, a lot of people say this is too hot, it's uncomfortable. Well, you know what? Safe and Simple came out with one, and Coloplast makes one. This Coloplast one is really nice. So I'll go stand up. Let's see if I can put it on. It has like a little pocket to put your hand in. So you put it on, and you would cut out a hole for your hole in one of the panels, put it over your stoma, and pull it together. Voila.
Right.
And I want to tell you, with these Coloplast ones, get it a size larger, because this is a large and it's tight on me. Yeah, but my rep told me, she said they run very small, so get a larger size.
And that's the Coloplast ones.
Yeah, bravo. Okay, but I love this. New Hope, Safe and Simple makes one too. Again, they're just slightly different materials, very similar, and they come in black. They're not all white. They're not all sterile looking, you know. So very similar with the pocket for your hand to pull it together. Makes it a little easier as opposed to having to, you know, just pull some piece. So this gives you strength to like pull it over.
Okay, cool. And then Kathleen also shares that she had a mesh put in and it only lasted a year. And yeah, it's only a year, so that's not much. That's really very short.
And it reoccurred. Yeah.
And then Harry says he also had a mesh as well when at first he had a urostomy. So Orla's asking best hernia belt. Again, Orla, I think that's probably, you got to try different ones. I saw with what Anita just showed, you know, there's very different sizes, different materials. So I would imagine that you got
how big your hernia is. You know, how big is your hernia? If it's, you know, fairly small, you know, you might want to try the Coloplast, or Safe and Simple is a nice one. Or if it's, you know, really a really big bulger, I always suggest to go to New Hope, because again, it's going to be custom fit, and that would be more supportive. Some people even just wear maternity pants, and they find that that helps give them support.
Yeah. And I'll be talking about this hopefully in a further show. In another show is an Irish company called Thea Healthcare. They're going to be coming over here in the US here shortly, but their undies for women, they are really supportive. I use them all the time, and the material is fantastic. Really supportive. So I'll be telling you more about them on another show. So check back in about that.
And a lot of women wear Spanx, okay, and find that gives them good support. Okay, yep. So, but the advantage with the support belt is that they have an opening for your pouch to come through. If you wear Spanx, you're not cutting a hole in your Spanx. Right.
Yeah.
Okay. So that is the big advantage of this. And if you cut a hole, it's going to unravel. All these other appliances are made so that it doesn't unravel. Okay. I've seen people get regular abdominal waistbands, and they cut a hole in it, and then they duct tape it all around.
I mean, a lot of work, but sometimes you got to do what you got to do.
Exactly. Yeah. So
Steve is wondering, do hernias ever resolve on their own?
No, only when you lay down.
Only when you lay down and apply that pressure.
Yeah, they don't resolve on their own. They just get bigger. So really be careful.
Okay, so all right, so if they get bigger, okay, that would make sense. Yeah.
So guard it now, protect it now. Don't let it get bigger like that man.
Right. Okay.
So his didn't start out that way.
Right. Glad to Orla is saying that she's needs to lose a little belly fat, and now she is motivated. Yes, get motivated. Join me on Thursday morning.
She's Elaine. She's amazing. Such positive energy.
Let me just see what this is from Sandra. I'm going to just pull this in so it's easier for me to read and for you to see as well. Thank you. My hernias become active and break the seal of my pouch just before output comes charging out, and pancakes almost every time I have output. This is the quality of life, disappointed and discouraged. Yeah. Any advice with that, Anita?
I would definitely look into getting the Coloplast Flip product. You can call and get samples from them. That is really, it's a wonderful product. I don't know what you're using now, but remeasure your stoma, call them, and get some samples of that product, and that might really help. As far as the pancaking, sometimes, again, using a lubricant in the pouch, and it tends to be quite annoying. You just gotta have to kind of push it down.
Yeah.
So
yes, it is quite
not that much you can do for that.
Yes, Orla is saying pancaking sucks. Yes, it does. I'm so glad I actually don't get much pancaking, so that's good. Kathleen is saying, so glad you did this show. Thank you, Kathleen. I think it's been amazing as well. She is also asking, can you show a technique to manipulate them? I'm not quite sure what you mean. To manipulate hernia.
Oh, yeah. Okay.
You mean just pressing in?
Yeah. So when you got your belly, so say this is my stoma, you're laying down, just press all around, and just lay down for a while, and just press your belly. Yeah. I want to get the flip. Hold on one second.
Okay, cool. And then just seeing what other comments. Lenora, okay, yes, tuning in from upstate New York. And just as a reminder, if you are tuning in and you have questions, so if you're watching this on the replay and you have questions after the fact, post them up and we will try and get you some answers. Please put in comments, please share. And if you want to do a consult directly with Nurse Anita, then go to her website. It's Anita.
Anita Nurse.